Welcome and thank you for joining us for the second installment of our four-part Recreational Water National Webinar Series. I'm Christy Denbrock, Chief Learning Officer at MAHC, and I will be your moderator. This webinar focuses on recent updates to the 2023 Model Aquatic Health Code, 4th edition. Our first presenter is Commander Joe Laco. Joe is an active duty service member of the United States Public Health Service and is stationed at the Center for Disease Control and Prevention in Atlanta, Georgia. Commander Laco is an environmental health scientist in the National Center for Environmental Health Food, Water, and Environmental Health Services branch. He provides environmental health technical support and expertise to state and local health departments, U.S. territories, and tribes. He received a bachelor's degree in biology from Ohio University and a master's of science degree in environmental health from East Tennessee State University. Joining him today is Dewey Case. Dewey serves as the Technical Director for the Council of the Model Aquatic Health Code. He has served in various roles with the YMCA of the United States, the local and state chapters of the American Red Cross, and has managed various aquatic facilities for 24 years. Dewey has earned multiple instructor trainer certifications from the American Red Cross, as well as instructor credentials with the Pool and Hot Tub Alliance. We ask that you please write your questions into the chat box and we will address them at the end of the presentation. If you are not a MAHC member and enjoy this session, we invite you to become one at mahc.org. Commander Laco, will you go ahead and get us started?
Yeah, thanks, Christy. I am going to go ahead and share my screen. Can you see that all right, Christy?
Yes.
All right. Well, as mentioned, this is webinar number 2 of MAHC's water webinar series. This one's called What to Know, the new edition of CDC's Model Aquatic Health Code. Earlier this year, in the first quarter, we put out the 4th edition for the Model Aquatic Health Code after a few years of trying to get it put together. We ran into some delays, particularly with that COVID pandemic. So I'm going to go over with you today a few highlights and some of the changes and some of the tools that we have available related to the MACH. Before I get started, though, I wanted to acknowledge Samaria, Michelle, and Dewey. The 4 of us worked diligently together for a couple years getting this 4th edition put out, particularly Samaria and Michelle also gave this presentation to other conferences and other meetings to get the word out about some of the major changes that you can find in the 4th edition MACH. So this, a lot of this presentation is mirrored off of presentations that they had put together as well. So the MACH 4th edition had over 500 change requests received. Some of them were editorial, some of them were substantive changes to how pools are to be operated and managed. So we had to go through all of those together with the Council for the Model Aquatic Health Code, the CMAC, and the Technical Review Committee, which I was a part of, looked at every single one of these 500 plus change requests. Some of the changes that were accepted were technical changes. We worked really hard on trying to have consistency with the language throughout the MACH code language and annex. Sometimes we would use the word aquatic venue. Sometimes we would use the word pool. Sometimes we'd say safety line, and sometimes we'd say rope and safety line. So we worked to get that consistency found throughout the MACH. And that also involved with updating some of the definitions and terms used. We had one significant format change with the addition of Chapter 7. This will be at the end of the code language document, and it'll allow us to add special venue types as we come up with new language and new recommendations that'll be added to future additions to the MAC. The great example that we had was the float tanks. We added float tanks to the 3rd edition MAC. It was spread throughout Chapter 4 and Chapter 5. Well, we pulled all that out and moved it into its own chapter. Chapter 7.1 is float tanks and for special venues. So of those 500, we accepted and approved over 300 changes between the 3rd edition and the 4th edition MAC. So monumental endeavor. One of those language consistencies that we worked on was this term secondary treatment. We'd call it secondary disinfection, secondary treatment, secondary disinfection treatment. So we got consistency on that and adjusted the definitions. And you'll see that in MAC 47332. And it covers the log inactivation of Cryptosporidium oocyst in particular and installation. So no longer limits the types of equipment that could be used to meet the specified treatment requirement, which would allow more and possibly lower cost options for meeting the same goal. And it also sticks to its name in that for splash pads, it requires the secondary system, whether that's UV or ozone, to be located after the feature pump, but prior to the feature nozzle. So 100% of the water is treated prior to reaching the bathers. And that's specifically laid out in 473322 for installation of that secondary treatment in regards to splash pads. I'm working on 2 screens here, you can bear with me. We did add a closure item related to cyanuric acid. There were several change requests that were submitted. Very few of those related to cyanuric acid were accepted, with the exception of this one. It establishes the CYA to chlorine ratio of being 45:1. That's always been implied in the MAC with a 90 parts per million CYA as our operating limit listed in the MAC, and the 2 parts per million operating ideal for free chlorine in the MAC. So 90:2, 45:1. We established a closure item if that ratio is exceeded. So it does leave quite a bit of wiggle room in regards to the exact amount of cyanuric acid in relationship to the exact amount of chlorine. So this would be indicated as an intimate health hazard and require immediate correction and immediate closure. On a special note, there was also a change request submitted for another closure item for cyanuric acid that was not accepted for an upper limit of 300 parts per million. We didn't feel that the evidence was substantive enough to support that to be added. So maybe in the future, but more work is needed in that area before we can have any other changes like that. Starting platforms. This is more in line with what you would see in competitive swim meets, competitive swimming at the collegiate level, and even with children and at the high school level. Currently in the MAC, it shows 4 feet for the water depth at the wall, right below the starting platform. There was a CR, change request, that was submitted for 5 feet to make a deeper requirement in the name of safety with spinal cord injuries. So the TRC took a look at this and they revised the 5 feet to 6 feet, given that 4 feet poses an injury hazard and the data supports changing to the minimum of 6 feet. The board of directors for CMAC, they approved this and they approved it for new construction and for substantial alterations. CDC felt that might be a little bit burdensome, so we revised it so it only applies for new construction. So when starting platforms are involved for competitive swimming, the water depth there at the wall should be 6 feet, only for new construction, and this will help keep existing facilities from undergoing expensive modifications. Those are some of the really big heavy hitters for the changes you could expect to see in the MAC. There's another one that is with pH. We expanded the pH operating range from 7.2 to 7.8. We shifted that down to 7.0 to 7.8. So it is quite a bit shift for an operating range for a pH, knowing that chlorine works better to disable viruses and pathogens at lower pHs. There are some concerns that lowering it to 7.0 would make it more acidic and maybe have some corrosive properties, but 7.0 is neutral on the pH scale. I wanted to talk about this one specifically because the closure items that we find in the MAC and related to pH remained the same. It still requires being above a pH above 8.0 or a pH below 6.5 before you would have an immediate closure. So there's still a little bit of wiggle room on either side of that operating range to get it where it's supposed to be. I would be remiss if I didn't put a plug in here for a Healthy and Safe Swimming Week. Historically, CDC has always tried to put out the word in regards to swimming health, safety, bather health, the week before Memorial Day. Memorial Day across the country is typically known as the kickoff to swim season. And that goes for southern states, but even some northern states as well. The water might be a little colder up north. Our pool in my neighborhood here is already open, and I'm not getting in it. It's freezing. But this week, our Healthy and Safe Swimming Week is May 22nd to 28th. And this year's theme is Got Diarrhea? Don't Swim. And I really like this because most of what we do with safe swimming and bathing is about keeping those pathogens that are lots of times found in human fecal material from getting into people's mouths. And if you don't poop in the water in the first place, it's not going to be in there for people to accidentally swallow or accidentally get water splashed into their mouth. So Healthy and Safe Swimming Week on CDC's website. You could do a simple search for Healthy and Safe Swimming Week. They have lots of tools available for operators and owners, but also jurisdictions and health departments about pathogens that you might find in the swimming environments and some ways to prevent that from becoming a problem. They have, of course, really creative messaging and posters. As you can see there on the right, diarrhea and swimming don't mix. If you wouldn't swim in your toilet, then maybe you don't want to poop in your pool. I've always been a fan of the creative messaging that they have for our swimming safety on CDC's website. Another big part of the tools that we have on the Healthy and Safe Swimming website is the communication toolkit. And the communications toolkit is for public health professionals to promote healthy and safe swimming messages on social media, websites, and other communication channels during Healthy and Safe Swimming Week and throughout the year. So part of that toolkit, you'll have guidance on how to reach out to partners, how to post information, warnings, recommendations on social media, advice for issuing a press release, graphics, posters, infographics. And the way you can get there is just go to cdc.gov, our main public-facing website, and you can type in a search for healthy water. And then from there, there's a menu on the left. You can click on healthy swimming, and you'll see the tab for healthy and safe swimming week. Michelle Lasso, my colleague in the National Center for Emerging Zoonotic and Infectious Diseases, Healthy and Safe Swimming Week, as well as the Healthy Swimming website and materials and guidance. She heads that. So a lot of work goes into this every single year, and she deserves a lot of credit for that. It varies on what the theme is from year to year, and this one is a really good one. Basically, don't poop in the pool, especially if you have diarrhea. Now, I would be remiss if I didn't share with you some more graphics that are related to Healthy and Safe Swimming Week and to healthy swimming. So I have a few of my favorites that I'm going to show you. This one is a GIF that shows a child enjoying their time at the pool, but having a little accident along the way. So don't leave your mark at the pool this summer. It only takes one person with diarrhea to contaminate the entire pool. And this kid didn't get the message. She keeps going down over and over and over again. This is another one with a similar message about keeping kids that are sick or prone to diarrhea or having diarrhea out of the pool. And if you're sick, keep them out of the pool and make sure that poop isn't going into the pool, particularly with diaper age children. And here's one more GIF. You could see this guy here likes to pee in the pool. And I think this is a really good one because if you look closely after the kid pees in the pool, if you look at our swimmer and that girl on the right, both their eyes turn red. So that kind of tells the story of what's being indicated there on the bottom, that pee and chlorine creates chemicals that can make your eyes red and itchy. And we know that nitrogen that's found in urine, when it mixes with free chlorine, it can produce chloramines. And chloramines are irritants to your eyes and your skin, as well as your respiratory tract, particularly in indoors pool environments. But all of these GIFs and posters are available and free on the Healthy Swimming website. Next, I'd like to talk about some of the tools that we've had for the MACH. And these are specific for CDC's pool guidance that is spelled out in our Model Aquatic Health Code. So we've had the inspection form, what we've called the cheat sheet, which is the instructions for the inspection form, as well as a cross-reference guide. Those have all been updated to match the changes that were in the 4th edition MACH. The inspection form has a couple of them that I wanted to point out. One is that closure item of the CYA to free chlorine ratio of 45:1. You'll find that on the inspection form. We used to call it the Aquatics Facility Inspection Report. There's a mouthful. So we shortened the name of it to our inspection form. That's what everybody calls it anyway. The new operating range for pH, that was the lower end, was moved down to 7.0, is also reflective in the new available inspection form. There's also some changes to the appearance and the format. It's a little easier on the eyes. The critical closure items have some color pop out that make them stand out compared to the rest of the regular inspection items that you'll see. So we have this other document we call this the cheat sheet. And the cheat sheet is basically an instruction form that outlines what to do, what to look for, how to observe each item on the inspection sheet. And there's 52 items on the inspection sheet in regards to the deck area, the water chemistry, to the recirculation pumps and filtration. It's quite in-depth. And it does highlight and explains what the intimate health hazards as they relate to the closure items. And we also have another document called the cross-reference guide. And the cross-reference guide, it was developed for use in the field while conducting aquatic venue inspections and for report development. The reference guide links the MACH Aquatic Facility Inspection Report. There it is. That's the old name. Now we just call it the inspection form. It links the form to content that you can find in the code language document. So when you're looking at your inspection form and you see item number 12, where can I find item number 12 in the MACH? We all know the MACH's a whopper of a document. So the cross-reference guide is a quick go-to that tells you the different chapters and pages of where you can find everything that's related to inspection item number 12. And that's available for all 52 items. But allows an inspector to quickly locate code language requirements and supporting information in the annex needed to develop a comprehensive and detailed inspection report. The reference guide lists the most important code language and annex elements by inspection form item number. Another tool that's not available on CDC's website, but it's available on NEHA's website in their continuing education online learning platform. It's a pool inspection training course. I worked with NEHA several years ago, and we developed a MACH-based pool inspection training. And it was really geared off of this inspection form, our MACH-based inspection form. It is based off of the 2018, the third edition MACH, but all of the concepts are still going to be relevant. I wanted to let you know how you can find this training. It is free. You don't have to be a NEHA member to access it, but the way you find it is not that intuitive. So when you go to the NEHA website, you'll need to create a NEHA account. And to purchase the course at zero cost, you have to go to the shop menu and then browse the bookstore and then just do a search for pool inspection. And you'll see the course as you scroll through the items that are available for purchase. You'll see this logo on here for pool inspection training for environmental health professionals. That's the one you want to click on and the one you want to grab at no cost. And then after you check out, your bill will be $0. You'll have access to that training. It's quite long. I believe I can't remember if it's 8 or 12 modules, and each module takes, I'd say, at least an hour to complete. It's not something you can do in just a couple hours in an afternoon. But it also allows you to earn 8 continuing education units, particularly if you're a registered sanitarian through NEHA. Those CEs can be used for maintaining your credential. And we have another tool that NEHA is working on that's in progress. It's called SafeD. We all know what SafeD stands for. I'm just kidding. None of us know what that stands for. I'm going to tell you. It's Standard for Aquatic Facility Environments Data. So SafeD is just the acronym. And it's a data model that's a standardized format for publishing aquatic facility inspection information across jurisdictions consistently. The design is based on the critical fields within the MACH, as well as a scan of more than 1,000 Environmental Health Agency inspections and inspection reports, and has already been beta tested in 4 demonstration sites in 4 different jurisdictions. So the concept behind this is that it will be an open data platform that collects pool inspections in a standardized way with the same type of information being collected across jurisdictions, and then be able to pull those together and develop a best practices guide and a way for jurisdictions to share their data, talk about things in the same way, all while we're on the same page. This is scheduled to go live later this year. And I put on your screen there, the websites on neha.org, where you could read a little bit more about it. It's still in development, still getting fine-tuned, but there is a little bit more information about safety and the open data and collection standard. I'm at 25 minutes here, and I want to make sure my colleague Dewey Case has plenty of opportunity to share with you what the CMAC is doing already for the 5th edition of the MAC, even though we just released the 4th edition of the MAC. There's my little disclaimer at the bottom there that the findings and conclusions of this presentation are those of the author. Those are mine and not necessarily represent the official position of CDC. So with that, I'll hand it back to Christy and to Dewey for part 2 and the second half of this today.
Thank you, Commander. So Dewey, why don't you get started? Thank you.
Certainly will. Thank you, Christy. Thank you very much. So yeah, and thank you, Joe, for that introduction. It's hard to believe that we're already starting work for the 5th edition. Time definitely flies when it comes to updating the MAC. So just kind of as a preface, right? Over the last couple of years, CMAC has put a significant ton of work and thought into how can we improve the submission process. And we've come up with some things that were targeted to help smooth the process out, help a little bit with transparency, and ultimately make it a more streamlined process for all involved. So that's what I'm going to talk about today, right? Hopefully it won't take 25 minutes. So let's just kind of get started. So what was the impetus for this? As Joe mentioned earlier in this webinar, CMAC was slammed with change requests for the 4th edition. That 531, as well as a very compressed review time, put a significant amount of stress onto our volunteers and to the whole process as a whole. So we really wanted to streamline this process to improve workflow for our volunteers, to help the submission process overall, and to really take some pressure off all involved. And the other reason we wanted to was also to make the CRs a better quality. We had a significant number of CRs for the 4th edition that were submitted by someone that, he had multiple CRs that conflicted. They conflicted with themselves. So it was definitely challenging to have the TRC navigate that process, right? And to address those. So we definitely made several changes. So what does that look like, right? So kind of the first thing was limiting CR submissions to 50 entries. We'll talk about that momentarily. We're only accepting substantive changes. We're not accepting editorial CRs. We are not accepting CRs for the MAC Annex. And overall, we wanted to improve the review process as a whole. So these were kind of the 4 areas of proposed changes that we were looking at, and we'll flesh these out. So as far as limiting CR submissions, we selected a limit of 50 CRs per person, which is still a lot. It is a lot of CRs. How did we come up with 50? We looked at the historical submissions per person for change request over the 2nd, 3rd, and 4th editions. And basically what we were seeing was the average individual will submit 5 change requests. You might have some that submit 10, some that would submit only 1 or 2. And you had the oddity, the rarity where you had 100 submissions. And so when we're looking at that and just thinking, that's one area that we can do to be reasonable and not withhold any CRs or any recommended changes to the MAC arbitrarily, but still be able to have some meaningful changes, right? So we took that average number of 5 and multiplied it by 10. Pretty simple, no complex formulas there. And, at that 10 times the level of the average submission, we feel that's an adequate number of CRs for an individual to submit. That still gives them plenty of latitude to submit meaningful CRs for the MAC. What the 50 per person submission will do is that it will make people think more about their submissions and what they're proposed as far as changes. So we wind up with a better quality CR, right? So there's no really significant impact on the quality of the submissions. And obviously from a review process, we only have 12 to 13 members of the TRC. So if you have 531 submissions, that is well over 50 CRs that each facilitator would have to review. And that's a lot for a volunteer. That's an awful lot for a volunteer. So this also helps us be more respectful of our volunteers and our experts as they're generously donating their time to assist in this important thing called the MAC. No editorial CRs. A significant number of CRs were editorial in nature, and they could certainly be handled in a different manner, right? So one thing on one decision on not allowing editorial CRs is that edits to the MAC are the purview of the CDC. We don't need a change request to change a plus sign necessarily, or to correct a small caps when there's no definition, or things of that nature, or formatting issues. So that's solely the purview of the CDC. So by sending those on direct, we can still catch those grammatical changes that are needed, but we're going to, again, be more respectful of our volunteers and for the review process by not unnecessarily stacking it with editorial change requests, right? Now, what I want to be clear on is this does not mean that you cannot submit an editorial CR. All this means is that anything submitted that's editorial in nature will not go to the TRC, and it will be submitted directly to CDC for consideration. There is no vote. There is no review by our technical support committees. It's just a straight shift. So how are we determining what is an editorial CR, right? It has to have a meaningful change, meaning that editorial recommendation changes the substantive text of the MAC. And we help define that with a meaningful change, with a change that alters the intent or meaning, or provides further technical clarification for any given code section. So if that CR that's editorial doesn't meet that definition of meaningful change, it goes straight to CDC. We'll talk in a moment about our review board to help serve as a check and balance to make sure things are being labeled appropriately. And we're not allowing MAC annex change request, right? And again, the annex is something that's always been under the purview and discretion of the CDC. The MAC and the code and the annex are CDC documents, right? But the CDC does reserve the right to modify the annex at any time to help provide explanations to set MAC code sections, to update it based off research or any other function. So the change request this whole time, really, we're just coming in for the code. So, and the annex is also changed when the code is changed, right? So adding in annex CRs for the TRC to evaluate adds a certain measure of unnecessary complexity and also confusion in the review and voting process. So we wanted to clarify that. What we will do is we've had a long-standing committee that has helped CDC navigate the annex. We will be reactivating that committee in the coming months to make recommendations to the CDC for annex information. This does not necessarily mean that if someone is recommending info for the annex, that it will not be considered at all. That is actually quite the contrary. Our TRC, Technical Review Committee, as they form their scope of work, as well as the technical support committees, one of their charges is to identify change requests that may need annex information. So that is being used as a resource to identify that, right? And then as a submitter, if you really just wanted to submit something for the annex, that's fine. You know, we have on the form where that the submission form where that can be notated, but that will not be part of the TRC review process. That will go straight to our annex committee and CDC for recommendation. Again, there is no need to vote on the annex. That was never the intent from the beginning. So how have we improved this review process, right, to make everyone's lives a little bit easier? Well, the first is we're doing electronic submissions. If you have submitted a change request in the past, you had to download this Word matrix type form, fill it out, save as, upload it, and all that fun stuff. Now it is strictly an online submission that you do directly through cmac.org. So one thing that you do have to do is you do have to register for the website. As a reminder, for change request, any interested stakeholder can submit a change request. A swim parent can submit a change request. A lap swimmer can submit a change request, right? If you're the end user, if you're anywhere in the chain from the planning and design to, you know, digging the pool, putting the water in and using it, you can submit a change request. So the only thing that does have to happen is you do have to register for the website, and that's an IT security issue, and that's the impetus there. I do have to say that while anyone can submit a change request, only CMAC members can vote on those change requests. We've also created an editorial review board. So if we think back a couple of slides where we were saying no editorial CRs, the TRC will not consider editorial CRs. We had significant discussion about what could be a substantive change, what couldn't be a substantive change, and how can we capture those that slip through that, you know, were listed as editorial, but honestly, it's a comma change or it has something in there that makes it a substantive change. So what we've done is created this editorial review board. So any change request submitted that's editorial in nature, we will review it with the TRC chair, the TRC vice chair, myself as technical director, a member of the CMAC board of directors, and a representative of the CDC. And the five of us will review editorial CRs. If we're in concurrence that it is editorial in nature, then that CR will be directly forwarded to CDC as part of the change process for consideration. If this board determines that, no, this is a substantive change request, then that will be forwarded to the technical review committee and the appropriate TSC for evaluation in the CR review process. What are some other changes we've made to the process? We've refined the roles of the TRC chair and vice chair. Those were actually not very well defined. So we have defined and refined, rather, to be very, very specific in what those roles are. In the past, the CR champions had to assign and decide whether or not a change request was needing a technical review from a TSC. So now we're automatically assigning CRs to review, removing the need for the facilitators to assign these to our technical support committees. And the TSC review process will be overseen by the TRC vice chair to ensure things are moving along and there's no log jams, so to speak. So as CRs come in, we will determine whether it is a water quality issue or design issue, safety issue. And in some cases, multiple TSCs will still review the same CR to provide feedback. One thing we've done, and we found a couple of spots in full disclosure on our website where the language still has to be changed, so we're working on that, is we've changed the name of CR champion to CR facilitator. This is a recommendation that came to us from one of our committees that honestly makes a lot of sense. And their concern was CR Champion makes it sound like that TRC member is supporting and pushing through that particular change request. That's not the intent. The intent is for that TRC member to act as the discussion agent, right? They do the research into the change request, they present that change request to the TRC, and they're supposed to take a neutral approach, only looking at it from a handful of metrics. So we felt that facilitator was better language. It's a neutral language that indicates to all involved that this TRC member will only be leading the discussion into that change request, and it has a neutral language where they're not going to necessarily support it, they're not going to necessarily be against it, right? So just leaving, again, nice neutral language. Another change we made is simultaneous submissions and reviews by the TSC and TRC for all change requests. In years prior, what would happen is we had a 6-month window for change requests to be received by CMAC, and then that submission window closed, and then we formed the TRC and TSCs, and then we reviewed the information, the submitted CRs. So we ended up with a June to January submission window, and then the technical review committee and TSCs would work from April, May to the end of July. So one thing that's really important to note is that can be a lot of work in a very, very short time span. I was actually a member of the technical review committee for the 3rd edition, and I remember many a 4-hour marathon review sessions in the middle of summer with active operations going on. So we changed the system a little bit to where the TRC and TSCs will perform their scope of work while change requests are coming in. This will allow a little bit more elongated process. We'll be able to address things in a more sensible manner. And most importantly, it's going to remove the need for marathon 4-hour sessions. So if you've noticed, right, CRs are now open. So if there is a change you want to make to the MAC, we are accepting change requests now. And the TRC has been formed. We had our orientation meeting actually yesterday, and we'll have our first call probably the first week of June, if not the last week of May, to begin reviewing CRs. So we're starting to work very, very quickly. The other thing to note is in prior years, prior versions, the TRC only had a 4-month working window. Here, we're going to have a much longer time span. So our TRC and TSCs are active now, and they'll be active until November 13th. It's important to note that change request windows, the window to submit a change request closes on October 13th. So the work of the TRC will extend a full month after the change request window closes. So in addition to reducing overall stress and reducing the weekly time commitment and their impact on operations and health inspections, not only is that being reduced, but we're also putting a safety window in place to where if we do have a change request come in at the last minute, we have adequate time to address it. If there are comments that come in after the TRC has already voted on a CR, then the TRC has a chance, has a window to be able to go back, review those comments, and see if it impacts the change in any form or fashion, or change rather, the TRC vote recommendation on that particular CR. So by working simultaneously, even though it's a longer month-wise commitment, the overall time commitment will probably be less, and it will also be much more efficient. And the other thing to note too is there may be times where the TRC doesn't have to meet. This may be especially true early on in the submission process. So, we're hoping that all of these makes a much more effective system and much vastly improved working conditions, so to speak, for our volunteers. Yep. So with that being said, I'm going to close this out.
Okay, Dewey and Joe, we have some questions. So I'm going to go ahead and start to go through those. And if both of you could just chime in and answer the questions, we'd appreciate it. The first one we have is, where can I find the change made to operating pH in the MAC?
That's going to be found in chapter 5 for operations and maintenance. Chapter 573 talks about water chemistry. Specifically, chapter 5734 is pH. So 57341 is specific for the new range of 7.0 to 7.8. And I posted that there in the chat.
Wonderful. Thank you, Joe. Another question is, Dewey, you had stated that the window is open now to submit a CR, and it goes until October 13th. Is that correct?
Correct.
And where would they go to submit that?
They would go to cmac.org. And then once they are signed, once they're at cmac.org, then they go to change request. And then they can submit that. Yep.
Okay, wonderful. Thank you.
The actual, let me give you the actual web address, Christy.
Thank you.
It is cmac.org/change_request.
Okay, would that be possible to have somebody drop that in the chat?
I'm doing it right now.
Wonderful. Thank
Yep.
you.
And let me say this real quick, Christy. I apologize for the slide set. I've got my slide set pulled up. I was going through it, and then when I closed it, I realized I didn't hit share screen. So I apologize to everyone.
That's fine. We enjoyed just listening to you and watching you tell us what was on it. So no problem, Dewey, at all. If you'd like, Christy, you could drop it in the chat, and people could see the slides that way. Yes.
Okay, I will do that.
Yeah, you never know what's going to happen on these webinars. The other question that we have here is, how can someone support the MAC in the 5th edition update process? If they want to get involved, how do they go about doing that?
Well, we've already formed our TRC, so that is closed for participants. We have formed our technical support committees as well. However, one thing we're trying to do is we're trying to make sure that public health is represented appropriately, right? So the MAC at the end of the day is a public health document, right? On top of everything else, that's what it is. So we made the decision CMAC-wise some time ago that every committee will have public health representation. And we've been really working hard for that to occur. The technical support committees are kind of a weird little thing, right? And that those are highly, highly technical and specialized. So for our TSCs only, we have made an exception there, where we're not requiring public health, but we're looking for it and we're asking for it. So we have 7 technical support committees. I think 3 right now have public health officials involved. So if you are a public health official specifically, and you have expertise in the areas of design and construction, water quality and disinfection, injury prevention, and air quality, right? And a couple of others, then feel free to reach out to us. You do have to be a CMAC member to serve on a committee. That's the only kind of hang up.
And how would they reach out to CMAC? Is there a link to that you could possibly drop in the chat as well?
Yep, I'll drop a link for the application process. And then also they can reach out to us at cmac.org, either way.
Excellent. We have a few more minutes, and those were the questions that we received. So Joe, Dewey, do you have any closing comments or anything you would like to add?
Dewey, are you able to put that file in the chat? Send it to everybody. There's an option to who could see it, who could review it. Click the everyone for your PowerPoint. A couple of folks were asking for it.
Okay. Yes, 1 second. Apparently, this is not my technical day. Apparently, I have been putting everything just to Joe.
Yeah, I've been just recopying them to everybody.
So I'm going to pop in both those links for the committee application and the change request. And then I'm going to pop in the slide set first.
Wonderful. Thank you.
And I apologize. Usually I'm a little bit better with technology. Today, obviously, it's not been the best tech day for me.
I am not an IT person whatsoever. That's why we have our wonderful team at NEHA that help us through these, and we still have issues that happen. So with that, I would like to thank everyone who took the time out of their busy schedule today to join us, and to please join us again in 2 weeks on May 25th for our third installment of the Recreational Water National Webinar Series with NEHA and the CDC. And I'm Christy Denbrock. Thank you again for joining us, and we look forward to seeing you in 2 weeks. And Dewey and Joe, thank you again for your expertise. It is very appreciated, and we thank you for keeping us safe in our aquatic facilities.
Great, thank you. Christy, if you can just leave up for like a minute for anyone to capture those links and files.
We will absolutely do that.
Great, thank you.
Okay, gentlemen, thank you very much. We appreciate your support.
Thanks for the opportunity, Christy.